Will it scar? Now, wherever we make the incision on the body, yes, it will leave a scar. The most important secret of plastic surgery, our field, is that we struggle to ensure these scars are finer and more delicate, and we try to conceal them. This is probably one of the most fundamental features that distinguishes us from other branches. We must also add grace and refinement to this. Now, in upper eyelid surgery, don't be afraid. Where do we hide the scar in upper eyelid surgery? Open your eyes, please. When we open our eyes, stand tall. A crease line forms right here. We aim to position the scar within this crease. So, when the patient opens and closes their eye, that stitch line doesn't look like a scar during those quick movements, but rather like the natural fold of the eyelid. The only exception is that in the early stages, all suture lines appear slightly redder than usual. If someone inspects it very closely, asking if you have a scar, they might notice that red line. Following eyelid surgery, the area between the suture line and the lashes will be a bit more swollen for about 3 to 4 weeks. These can be spotted if you inspect them closely, not at a normal conversational distance, but if you look to examine them, you might see them. You just need to be patient in the early period, but when 2 to 3 months have passed since the surgery, we expect it to be barely visible even upon close inspection. The eyelid is a region that truly heals very well. Unless we as surgeons have made a grave error, there are generally no issues with scarring in upper eyelid surgery. Naturally, one should not be overconfident. That is why I say there are no issues. Aside from that, as I mentioned, if we are careful with the pinch test and the amount of skin we excise, the probability of us experiencing a serious complication is also very, very low. We will be gentle, we will be controlled, and we will be respectful of anatomy. For instance, while excising the skin, we also remove some of the underlying muscle. We descend deeper to access the fat pocket. We reduce the fat volume. If we go deeper in an uncontrolled way, we can damage the muscle or its tendon called the levator that lifts our eyelid. So knowing the anatomy and performing this procedure by respecting the anatomy is necessary. To make a long story short, upper eyelid surgery is a very pleasant procedure. As a result, it is a surgery that can make the patient smile. And it is a surgery that can be applied in a practical way. It can solve your problems. It is a surgery that can help you a lot in solving your problems. If there are any other questions you are wondering about, please write them to us as a comment and we will gladly try to explain and inform you about them. If you have more private questions, sending them as a direct message instead of a comment will ensure that your questions are answered privately.